Hi, my name is Caitlin. I'm going to be performing a physical assessment on Liz today. I have gathered my equipment here on the table. We've provided privacy, and I used hand sanitizer as my hand hygiene. I noted Liz's gait when she walks in. She has a steady gait, walks with an upright posture. She's wearing clothes that are normal and appropriate for the weather today. She's clean, well-groomed, nourished. She's alert and oriented to person, place, time, and situation. There are no deformities noted at this time, no involuntary movements. Liz has an appropriate affect for her situation. She's in a generally good, well-mannered mood. Her skin is pale in color, but appropriate and normal for ethnicity. Upon assessment of her hands, her nails are clean and well-groomed. Capillary refill is less than 3 seconds. Liz hears normal voice tones. No hearing loss noted. She makes appropriate eye contact. Now I'm going to palpate her head. There's no lesions noted on the scalp. Her cranium is normocephalic. No tenderness noted. Her face is symmetrical. I'm going to palpate her sinuses. And also palpate the temporal artery. I'm going to assess her temporomandibular joint. Can you open your mouth for me? Close it. And again. It has free movement. There's no clicking or abnormalities noted. Next, I'm going to assess Liz's peripheral vision. Tell me when you see my fingers. No? Okay. No. No. Okay. Next, I want you to look toward my ear, and I'm going to shine a light to check your cornea reflexes. Good. Okay. Next, I want you to follow my finger. Okay. Next, I'm going to cover one eye, and I'm just going to assess the eye that's uncovered. And her eye stares straight ahead. The same on the other eye. And it keeps a fixed gaze as well. Next, I'm going to assess the external eye. There's no debris or redness or drainage noted. There's no redness to her conjunctiva. Her sclera is white. Her pupils are round, approximately 9 millimeters in size. There's no lesions noted in the eye. Next, I'm going to look to check for reaction to light. Just stare straight ahead at me, and I'm going to shine a bright light in your eyes. The same with the other eye. Pupils are equal, round, and reactive to light. Next, I'm going to assess Liz's ears. The external ear has no redness, no drainage, no debris noted. I'm going to pull up and back to assess the canal and the tympanic membrane. Tympanic membrane is clear, slightly white, no perforations noted, and there's no debris noted in the canal. Same with the other ear. The external ear has no debris, no redness, no drainage. Tympanic membrane is clear, off-white, no perforations noted, and there's no debris noted in the canal. Next, I'm going to perform the whisper test. If you could cover this ear and repeat back to me what I say.
Baseball.
Okay, same with the other ear. If you can cover this ear.
Cardinals.
Good. Next, I'm going to assess Liz's nose. The nose is symmetrical on the face. There's no deviation noted in the septum. Both nostrils are patent with no drainage noted. Mucosa is pink and moist. Next, I'm going to inspect her mouth. If you could, stick your tongue out straight for me. Okay, now say ah. Ah, good. Uvula is midline. No tonsils noted at this time. Okay, you can take your tongue back in. Open your mouth for me. are intact, no missing or loose teeth noted. Can you pick your tongue up for me? Palate is pink and moist as well. Okay. And if we were using a Snellen eye chart, I would have Liz stand 20 feet away and ask her to read the smallest line possible on the chart that isn't blurry. Next, I'm going to assess Liz's neck. It is symmetric. There are no masses or pulsations noted. No jugular vein distension. The carotid artery is palpable. I'm going to assess her thyroid. It is palpable as well. Trachea is midline with no deviations noted to the right or left. I'm going to also palpate her lymph nodes. And there are no palpable lymph nodes noted. Next, I'm going to assess Liz's lung and heart sounds. Her shoulders are symmetrical, so are her muscles. There are no masses or tenderness noted. Take a deep breath in and out for me. Expansion is symmetrical. Next, I'm going to auscultate the anterior lung sounds. Each time you feel my stethoscope, take a deep breath in and out. Next, I'll have you stand up. Well, actually, first I will use tactile firmitis. Each time you feel my hand on you, say 99.
99. 99. 99. 99.
Good. Okay, now I'll have you stand up and turn around and we'll do the posterior side. The shoulders are symmetrical. There's no tenderness or masses noted. Take a deep breath in and out for me. Expansion is symmetrical. Next, I'm going to percuss the posterior lung sounds. Good. Now I'm going to auscultate the posterior lung sounds. Deep breath for me. Now, each time you feel my stethoscope, if you could say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Good. Okay, I'll have you go ahead and sit back down. Next, I'm going to auscultate the heart sounds using both belt and diaphragm. First, I'm going to listen to the aortic, then the thalamic, then the tricuspid, and then the mitral. Then I will do the same again. Heart sounds are strong and regular. Rhythm is regular. All lung sounds are clear to auscultation bilaterally. And that concludes my health assessment. Hi, my name is Caitlin. I'm going to be performing a physical assessment on Liz today. I have gathered my equipment here on the table. We've provided privacy privacy, and I used hand sanitizer as my hand hygiene. I noted Liz's gait when she walks in. She has a steady gait, walks with an upright posture. She's wearing clothes that are normal and appropriate for the weather today. She's clean, well-groomed, nourished. She's alert and oriented to person, place, time, and situation. There are no deformities noted at this time, no involuntary movements. Liz has an appropriate affect for her situation. She's in a generally good, well-mannered mood. Her skin is pale in color, but appropriate and normal for ethnicity. Upon an assessment of her hands, her nails are clean and well-groomed. Capillary refill is less